So this video introduces you to the principles of stretching. Why do we stretch? Well, typically we stretch because we want to prevent injury or improve our flexibility. But does stretching do that? Well, it's pretty controversial. The evidence doesn't really point one way or the other, but I will say that there is a place for static stretching in a whole part of your fitness regime. So you need to make sure that when you're working with your patients that you understand when to use static stretching, when not to, and be able to communicate that and teach your patients what to do. So, what's the best recommendation? Well, you're going to spend a little bit more time learning about that in assessment class as well as in therapeutic interventions. So, I'm really just going to give you some of my best advice or some recommendations about how to use stretching and when to use stretching. You'll also see in the media gallery some stretching examples for the upper extremity and the lower extremity. So pay attention to those, but know that you're going to see lots of different variations of how to stretch body parts, both assisted, so you helping that athlete do the stretch, but also you're going to see times where the athlete can actually stretch themselves. So that's unassisted. So what's the best recommendation? Well, you really want to make sure that your athlete or patient warm up first. So what does that mean? So a lot of times athlete likes to put a hot pack on that particular body part that feels really tight. Is that wrong? No, that's fine. But the preference for me is if they're going to do that before you do any type of static stretching, that you have them do an active warm-up as well. What does that be? That could be them jogging, could be getting on the bike, could be doing arm swings or shoulder circles, just to try to get that body part that you're going to stretch dynamically moving. So you get the blood flow flowing to these muscles that you're going to stretch first. Then you can move into the static stretch itself. So get that muscle warm, then go ahead and do the static stretch. When you're doing the static stretch, you're going to hold that stretch for 20 to 30 seconds. If you hold it too short, 5 or 10 seconds, probably not going to be very effective. Any longer than 30 seconds, the evidence kind of says that's probably too long and you're not going to see much benefit from going longer than 30 seconds. You probably want to make sure that you're doing that probably at least twice a day. Many times I recommend to the patients that they do some stretching on their own when they wake up in the morning, before they go to bed, and we do it before and after practice. Now, a couple of things to keep in mind. One is that stretching can be uncomfortable, but it should not be painful. Okay? So it's really important when you're stretching that you communicate that to your patient. The other piece is to make sure that the patient position is appropriate for the muscle that you're going to be testing. So when you're watching the video, pay attention to the patient position and the way that you're moving that muscle into space. The last thing I want to talk about is kind of a little bit of a trick that if you're having somebody who is struggling with a particular stretch, you can have them contract against you and then have them relax. This idea of contract, relax allows that muscle to relax a little bit more so that you can get a fuller range of motion for that stretch. You will see that when we demonstrate those stretches in the video. You'll see that contract, relax mechanism that can really be effective at improving the stretches that you do.